A surgeon from Channel 4's embarrassing bodies has avoided a tribunal and been allowed to keep working in the, despite being sued by up to 130 patients. Urologist Manu Nair, 53, allegedly left patients incontinent or infertile following surgery he carried out at 4 hospitals in the West Midlands. Some claim he treated patients for prostate cancer when they did not have the disease, and lawyers allege he used treatment yet to be approved for use outside clinical trials. The operations in question took place at 3 private hospitals, Spire Parkway in Solihull, Spire Little Aston, and BMI Priory, Edgbaston. They also took place at Heartland's NHS Hospital but after more than 3 years under investigation by the GMC, the watchdog has now decided he doesn't need to answer to a tribunal. Instead, he's been told he can keep working for the NHS, as long as he doesn't go private and he has a mentor at work. It comes despite law firm Irwin Mitchell's representing more than 60 people and Thompson's solicitors helping 70 others take legal action against him. Lawyers claim one legal case has already been settled, and there have been admissions of liability from the Heart of England NHS Foundation Trust on several others. The GMC refused to say where he was working now, but said he was listed as being connected to City Hospitals Sunderland NHS Foundation Trust. One ex-patient, one of around 70 being represented by Thompson's solicitors, said, "I am disappointed, annoyed, and upset that Mr. Nair has not been struck off and is being allowed to work in the NHS." Independent urologists have so far reviewed the cases of some 170 men. The married father of 2 Mr. Nair spent more than 3 years under investigation by the GMC, during which time he was allowed to continue working for the NHS. It is understood he worked at Southport and Ormskirk Hospital NHS Trust and Maidstone and Tunbridge Wells NHS Trust. Both trusts said they were fully aware of Mr. Nair's background and that he adhered to the conditions of his employment. But it has now been decided by the GMC that he won't face a tribunal after undertakings were agreed. The terms include telling the GMC where he works, to agree to a personal development plan to address deficiencies, only work in an NHS setting, and not to carry out certain procedures, except in life-threatening emergencies. Linda Milband, National Practice Lead for Medical Negligence at Thompson Solicitors, said, "While we believe that medical practitioners can and do learn lessons from mistakes, an NHS trust or private healthcare provider engaging someone who has faced this level of criticism and been the subject of a GMC investigation, should have in place a robust system of stringent and ongoing checks." Laura Daly, specialist medical negligence lawyer at Irwin Mitchell, said, "We have heard a number of hugely concerning accounts from clients regarding the treatment they received from Mr. Nair. Many of the patients have had prostate cancer treatment or surgery by the consultant urologist. Some have later questioned whether they ever had cancer, or if they did whether the surgery they received was adequate, while others were given a treatment known as HIFU, high-intensity focused ultrasound, which we allege had yet to be approved for use outside a clinical trial and which our clients had not been informed of. The huge impact that this has had on our clients cannot be overstated, with some being left suffering incontinence, pain when passing urine, and even facing the trauma of never being able to have children.